This conference will now be recorded.
Hi, I wanted to take a few minutes to share with you a tool that's been developed for the admissions and marketing team primarily. However, it could be used by other folks in the interdisciplinary team to help build on your knowledge of PDPM drivers and qualifiers. This tool is best used in an electronic version. And that is because there are things that are embedded within there that are going to assist you with identifying what sort of things that we're looking for in regards to the different components. So whether or not an admissions marketing person is a nurse by background, they could very easily take a look at all these yellow headers and identify whether or not a patient is experiencing one of these drivers within that heading. So for instance, for skin, you would know whether or not someone had a stage 3 pressure ulcer, stage 4, 2 or more stage 2 pressure ulcers. And you would simply put a check mark or an X next to any of those things. If there are none of those qualifiers, then you would skip through them. If someone is in the hospital and they have a diagnosis of pneumonia and they're getting oxygen while they're there, and they have also a diagnosis of asthma and COPD, you would simply put the X's there. The X's for the admission and marketing team really are meant so that you can start to ask the hospital for the medical records we're going to need to support these sorts of drivers once they're in our facility. So if you were to look at skin and hover over this yellow part, it's telling you that from the hospital to support the stage 4 pressure ulcers, we'd be looking for their treatment records, their wound consults, any infectious disease notes. For the respiratory, we would be looking for the respiratory consult notes, medication administration records. If they had something with infection, we would be looking for the medication administration record, the cost of those meds, any treatment records, IV flow sheets, vital signs with temperatures, wound consults, infectious disease. We don't need all of those on every patient, but it will be based on which check marks you place here underneath that infection heading. Then for cognition, if they have impaired cognition, then we would be looking for psych notes and social service notes that are indicating that for us. If they have anything going on from a cancer standpoint, we'd be looking for medications, treatments, and again, close attention to the cost of medications. Someone who's in the hospital experiencing behaviors such as delusions, depression diagnosis, hallucinations, if they have verbal outbursts or physical outbursts, they were wandering, you would look, and these are the types of things we would want to support that. The psych notes, emergency room notes, very important. Often when we get hospital records, they only cover from the point that the patient was admitted. And there are often a lot of qualifiers or different information that will lead us to those qualifiers embedded within the emergency room notes. So that's an important aspect of the records that we would be requesting. Somebody who's a diabetic looking for their nutrition, dietary notes, if they have some diabetic wounds, wound consults. And if somebody's a diabetic and they're wearing glasses or they have visual problems, ask them for the name of their ophthalmologist. Ask the hospital to find that information out. Once they're in the building, in the facility, we're able to then go and perhaps dig for some more information that will be a qualifier such as diabetic retinopathy. Under nutrition, we're looking for dietary notes, a list of their weights, any medications they're taking, and perhaps IV flow sheets if they've received IV fluids during their stay. Other diagnoses that are here or symptoms of things, inflammatory bowel, cirrhosis, CP, all of those sorts of things would have therapy evals, GI consults, dialysis notes perhaps, or some transplant information. And then for cardiac, specifically endocarditis, cardiology consults, infectious disease, and perhaps medication administration. The tool itself is set up kind of a half and half deal. So on the left-hand side with all of the yellow and black, that is all PDPM driven and prompts. And on the right-hand side, it's developed to allow you to enter information that perhaps you would be filling in your normal collection of data at this point. This, again, has not been made mandatory. It is just a resource. If it's something that will help the admissions team, or if it's something that we can modify to combine it with something else you're already looking at, we can do that. So don't think that anything in this education is saying to you, abandon everything else you've done and start to use this. It's only a tool. It's a suggestion. It's something available to you. It can be worked on. So that being said, you have all of this different information on here. And so the admissions folks have done all of their little X's here, and they've asked the hospital, or they've looked to see whatever records they can get and try to streamline that coming to the facility along with either the referral and or the discharge and admission paperwork. So now the MDS coordinator, the facility has all this stuff. They're uploading anything into PCC. What are all these letters and parentheses and these asterisks? What is all of this nonsense about? This is where the education comes in. Whenever you see something next to this in parentheses, that is an indicator of where they would fall in the nursing component under PDPM. So an L, for instance, for the stage 4 pressure ulcer, this patient would fall in a special care low, unless there was something else later on down the line that would put them into a high. But they would fall into a special care low. And ding, 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 extra money, extra points for the asterisk. This is 1 NTA point. You'll see other things here that are multiple asterisks, and that would indicate how many NTA points you would get for that. So this person here, asthma COPD, two asterisks, 2 NTA points, plus a stage 4, now we got 3 NTA points. It allows the MDS, it allows the facility to really project where this person's gonna fall in the PDPM score. So indirectly, you're assisting with those revenue projections. You're assisting with the facility kind of costing out and knowing what they're going to get for this patient as they're coming in the building. Also, if an administrator has just this yellow and black aspect pulled up, or they have a blank copy of it on their desktop or whatever it may be, they can listen to these sorts of things inside morning meeting. These are all should be prompts to make sure that we've captured this for the patient either already or because something is new. So if all of a sudden somebody gets a new weight done and it pushes them into a morbid obesity level, and they hear that discussion, now we're able to talk about, did we already capture that? And if not, should we do another assessment? We hear a discussion in morning report about weight loss. We would know, did we already capture that? Did they have a fever? Because that's what you need for it. Take a look. So these are all things that become prompts for the whole team to be listening for, and then being able to say, hey, do we need to look at doing another MDS for this person? One other aspect of this tool is the Moon form. So a lot of folks weren't familiar with what the Moon form is and what it meant for us. And you probably wouldn't become familiar with it until you've experienced the fact that a person had an observation stay that you didn't recognize and you thought they had a qualifying hospital stay. We billed Medicare and it was declined. It was denied because they didn't have a qualifying hospital stay. We've had this public health emergency going on for over a year now, a waiver that gets rid of the qualifying hospital stay. That is supposed to be coming to an end in April. If they don't extend it, it again becomes very important for everyone to understand people need a 3-day qualifying hospital stay. And when they are in the hospital, if any of their days are observation, the hospital is expected to give them a Moon form. So what does the Moon form look like, and what does Moon stand for? If you click on this in the tool, it will bring you to the Moon form. Medicare Outpatient Observation Notice. The hospital gives it to the resident or the family member, and what they're identifying is that you have had some observation days. And it goes on to let them know that a nursing home requires a 3-day qualifying stay, and that an inpatient stay doesn't begin until they admit them. So whenever someone has received this, this should be your first indicator that, oh, they've had observation days. I need to see how many, because I need to ensure that we've had 3 midnights that were true inpatient days. So you should be asking the questions, have you received one of these forms once the waiver is no longer in place? If they say yes, then you need to investigate further to see how many days were observation days, so that you're able to determine whether or not bringing this person in, admitting this patient today, will truly allow them to access their Medicare. All right, so some people weren't aware of the notice, they didn't understand how it worked, they didn't ever seen one before, so that's what the purpose of putting it in this tool was, for any of you to see it. So really, again, this is basically for a pre-admission process for you to kind of identify and start jump-starting the medical record that we need to have shared with us. Once it's at the facility level, MDS people can look at your check marks and say, oh, they said there's a stage 4. I really need to be looking for medical records related to that. Or they said they have pneumonia, but I don't see a chest x-ray. I don't see that in here. Let me keep looking. And then other people who are using this in a blank format, perhaps, to use it as a prompt throughout meetings to say, oh, let's take a look at that. I didn't capture that before. Maybe I need to do something different now so that we can improve our revenue. All right, so again, not mandatory, not meant to use for you to make decisions about referrals, admissions, or denials. It's truly just a reinforced educational tool for PDPM qualifiers. Thank you and have a great day.